This is lab 12. In this lab, we're going to be discussing cartilage, articulations, or joints, as well as movements. Let's get right into our cartilage for this lab. This image is of hyaline cartilage, and we're showing here individual chondrocytes, which are the cells, the cellular component found in cartilage. And hyaline cartilage is going to be a cartilage that you find on our ribs. This is where ribs will connect to the sternum. And then also it's going to be found in fetal skeletons and in the ends of long bones before those bones fuse together at that epiphyseal plate with development. And hyaline cartilage is going to have some different appearances. And here we see that these chondrocytes are arranged in this roughly linear fashion. And they're kind of stacked together. They kind of look like a big stack of pancakes. You can think of it that way. But as these chondrocytes migrate away from the edge of this tissue, we see less of that stacking or linear appearance of those chondrocytes, and now we're seeing them more as paired. And they almost seem to look like googly eyes that you would put on an arts and craft project. The next cartilage we have is fibrocartilage. This is cartilage that you'll find typically at your intervertebral discs, so in between vertebrae. And we're showing our chondrocytes here. And so this cartilage will have chondrocytes as well. However, compared to our hyaline cartilage, we see much more collagen fibers here. And that gives it kind of this wavy appearance that we see here. And then finally we have elastic cartilage. And elastic cartilage is very straightforward. It stains very dark. It's going to have those dark elastic fibers like we saw with elastic connective tissue. We have our chondrocytes here. They kind of have that paired appearance, but totally different than hyaline, because hyaline cartilage doesn't have those elastic fibers. And this, you find elastic cartilage at your ears and also at your nose, and this allows you to have a lot of flexibility at these locations. So with my ears, I can spin them around, turn them around as much as I want. And just like we saw with elastic connective tissue with our dermis, as soon as I let go, my ears just go back to its normal position. Same thing with my nose. I can twist my nose around, do whatever I want with it, and it'll just go back to its normal position. So now we're going to move into our joints. We have 4 major joint types. Okay, the first of which is a bony joint. Next is a fibrous joint, then cartilaginous joints, and then synovial joints. And these are our major joint types. There's 4 of them. Within each major joint type, we have subtypes. Within our fibrous joints, we have sutures. You find those at the skull. Gomphosis, these are going to be in our teeth. Syndesmosis, this is going to be radius and ulna. Within cartilaginous joints, we have synchondroses, that's at the ribs. And we also have symphysis, that's at your vertebral discs. And then for our synovial joints, we have gliding, hinge, pivot, condyloid, saddle, and ball and socket. And now we're going to go into each of these major joint types as well as their subtypes. The first is the bony joint here, and we find our bony joints at the epiphyseal plate. Bony joints are going to be the most immovable joints that we have. And when our bones finish developing, recall that epiphyseal plate fuses. that hyaline cartilage there becomes bone, and that bone can no longer grow anymore. And so we form this bony joint here when that epiphyseal plate fuses. We also have a bony joint at our mandibular plate. Our mandible is actually two individual bones that fuse together at the mandibular plate. Fibrous joints, we've got three subtypes. Sutures, those are going to be found at our skull. Gomphosis, this is going to be found at our teeth. We have these ligaments coming, extending out from our maxilla and our mandible, called periodontal ligaments. And this allows for some sort of movement of your teeth when you're chewing, and that breaks down, that helps to grind that food down. And then the third subtype is syndesmosis, and this is when you have two bones that are parallel to each other, and you actually have some connective tissue that is holding those bones in place. So a good example is between your radius and your ulna, as well as between your tibia and your fibula. That's what's shown here. We have a couple of different types of sutures. These are general suture types that we find in our skull. The first is called a serrate suture, and this is found at this suture here between the frontal and parietal bones. And you can see that the way that this bone is, these two bones are divided, they're actually interlocking. And an example of that in carpentry would be a dovetail joint, where these two pieces of wood are actually interlocking together. A lap suture is going to be found between your temporal and sphenoid bone, and this is when two bones have beveled edges and they actually hold each other in place. And another carpentry example is a miter joint here. And then a plane suture, our final type of suture, is where two bones that are relatively flat come together. And you find this at the hard palate when the two maxilla bones, the two sides of your maxilla bones, connect there. And a carpentry example would be a butt joint. You got two types of cartilaginous joints, synchondroses. This is, again, where your ribs connect to the sternum via hyaline cartilage, and where your clavicle connects to your manubrium, that superior portion of the sternum there. And then a symphysis is where you have intervertebral discs. An example of symphysis is intervertebral discs between two vertebrae, as well as the pubic symphysis. And then finally, our synovial joints are going to be our most movable joints. And our synovial joints are when two bones come together, and they're going to be surrounded by a membrane called the synovial membrane. And that synovial membrane is going to be filled with synovial fluid. And this allows for this nice fluid movement at this joint. At the ends of the bones, you have articular cartilage. This is going to prevent the bones from rubbing together. And then on the outside of your synovial membrane, you have a joint capsule. And this joint capsule is going to hold everything in place, and it's going to be reinforced by ligaments that hold these bones together. There are 6 subtypes of synovial joints, and for your practical quiz, you are responsible to know all of these. The first is the ball and socket joint. This is where you have a bone that's forming a ball, and then you have another bone that's forming a socket here. And so this is, we're showing an image of the shoulder joint here. Another example of your ball and socket joint would be your hip joint. Next is a pivot joint. This is best illustrated by your radius and your ulna, and this allows you to make kind of this rotating pivot motion. A saddle joint is found at your trapezium and your first metacarpal, and this allows you to make this kind of opposing action. The hinge is found at your elbow, between your humerus and your ulna, and this is, you've got one type of movement here. A plane joint is found in your carpals. This is also called a gliding joint. And then a condyloid joint is found between your metacarpals and your phalanx. And this is, I like to say this is your joint. So when you're wagging your finger like this. Now these synovial joints are going to allow us to do certain movements. And so before we move forward with specific types of synovial joints, it's really important to go over these movements. And these movements are not going to be important just for this lab, but when we move into muscles in a few weeks, these movements are going to be critical in understanding how muscles work. And so let's first define some of these movements. So you always hear, flex something, but what does that really mean? Well, in anatomy, it's defined as the decrease of a joint angle. And so when I flex my elbow, I'm decreasing my elbow joint. And so this is how we define flexion. The opposite of that would be extension. This would be increasing a joint angle. Hyperextension is when you increase a joint beyond anatomical position. So for example, if I hold my hand out like this, I can flex my hand and then I will extend it back to anatomical position. But when I extend it past anatomical position, this is called hyperextension. And you have some joints where hyperextension is a normal thing, that it's very possible to do. And then there are some joints where hyperextension is going to cause damage. So things like your knee, things like your elbow, those are joints you do not want to hyperextend. Abduction is when there's any sort of movement away from the midline. And so if I were to move my hands out like this, my arms up like this would be abduction because I'm moving it away from the midline. A nice way to think about this is if you're being abducted by aliens, you're getting abducted and moving away like this. And then the opposite of that is adduction, which would be moving your arms and hands back to the midline. Lateral rotation is rotating away from the midline. So if I were to stand with my arms like this and I rotate away from the midline, this is lateral rotation. And then the opposite would be medial rotation if I rotate towards the midline. Supination, this is similar to lateral rotation, but this is going to be specific to your hands and your feet. If you laterally rotate your hands, you have your palm facing up, and this is called supination. The opposite would be to rotate your hands or your feet medially, and that would be pronation. You can think of these two as supination is allowing you to hold a bowl of soup, and pronation is pouring that bowl of soup out. Protraction is if you move anteriorly, so a good way to visualize that is by protracting your neck. And then the opposite would be retraction, which is bringing it back to standard anatomical position, moving posteriorly. Inversion, this is similar to pronation, but this is specific to your feet now. this would be rotating your foot medially. And I can represent that by going like this. This would be inversion. And then eversion would be rotating your foot out laterally. If you sprain your ankle, typically you do that by inverting your foot, but you can also evert your foot and sprain your ankle that way. Dorsiflexion is if you point your toes posteriorly. So just imagine my hands are my feet here. We're going to point them superiorly, and then standing up on your tippy toes, this is going to be plantar flexion. This is pointing your toes inferiorly. Then our last movement is opposition, which is also opposing. And this is the ability for your thumb to move across your hand like this. And we know that having an opposable thumb is a very important evolutionary advantage for primates. It allowed us to, in evolutionary history, it allowed us to climb trees. It allowed us to hold tools and use tools. And so next time you're brushing your teeth at night, thank your opposable thumb for that, as well as anytime you're texting. Texting is made possible because of your opposable thumbs. And then finally, there are 5 specific joints in the body. These are all synovial joints. And we would like you to know the specific anatomical name of these joints. Naming joints is pretty straightforward. You take the name in general, you take the name of the superior bone and the inferior bone, and you stick them together and you've got your joint name. So this first joint, the temporomandibular joint, that is at your temple and your mandible. And so this is your jaw joint. This is an example of a hinge joint. Next is your glenohumeral. This is your shoulder joint, and this is a ball and socket joint. And it's called the glenohumeral joint because it's the glenoid cavity of the scapula and the humerus. And you combine those two words and you get glenohumeral joint. The acetabulofemoral joint is going to be your hip joint. And the name is acetabulo for the acetabulum of your pelvic girdle, and then your femur. And you combine the two and you get your acetabulofemoral joint. This is an example of a ball and socket joint. You have the Humeroulnar joint, and this is going to be your elbow. This is, again, the humerus and the ulna, and this is an example of a hinge joint. And then finally, you have the femorotibial joint, and this is going to be your knee. And so you have your femur and your tibia, put them together, and you have your femorotibial joint. And this again is an example of a hinge joint. Let's look at each of these joints individually now. First, we have the temporomandibular joint. That's named again because of the temporal bone and the mandible. And where those two bones meet to form this joint, we call that the temporomandibular joint. And this is a hinge joint. Next, we have the glenohumeral joint. We have the glenoid cavity on the scapula, and then the humerus is coming in here on the lateral side of the scapula. And so where these two bones meet, we call it the glenohumeral joint. Next, we have the acetabulofemoral joint. This is your hip joint, which is an example of a ball and socket. This feature here on the pelvic girdle is the acetabulum. This is your femur here. Where these two bones meet, we call it the acetabulofemoral joint. Next, we have the Humeroulnar joint. This is your elbow. This view here is an anterior view. This is a posterior view, and this would be a lateral view. We have the humerus up here. That's why we call it the humeral. And this is articulating with the ulna, hence the ulnar joint. remember, we do have the radius shown in these three images here. The radius is also going to be articulating at the humerus as well as at the ulna, but for our lab, we're going to call this the Humeroulnar joint. And then finally, we have the femorotibial joint. The femoral refers to the femur, and tibial refers to the tibia. And so this is our knee. This is, again, an example of a hinge joint. This view is anterior. This is an anterior view of your knee. And we have a bunch of ligaments here that are fair game for a practical quiz. These are going to be typically injured in sports where there's a lot of lateral movement, such as soccer, football, basketball. And anytime there's a perpendicular force on the knee, we can have tearing of these ligaments because recall from lab 6, this is made up of dense regular connective tissue. So it's really strong in that unidirectional plane, but anytime there's a perpendicular force, we're going to have tearing of this ligament, or of these ligaments, I should say. So everyone knows about their ACL. It's really called the anterior cruciate ligament, and that's going to be spanning right here. We also have a PCL, or the posterior cruciate ligament, and that's going to be just posterior to that anterior cruciate ligament, and it's going to be crossing it. So they're going to cross like that. The meniscus, this is also going to be a commonly injured area, or commonly injured feature in the knee. This meniscus, you have an medial and lateral, and the meniscus is going to serve as abrasion-resistant cartilage that prevents the femur and the tibia from rubbing together. Last two features here, you have the medial collateral ligament, or the MCL. And as the name suggests, this is going to be a ligament on the medial side of your femorotibial joint. It's going to connect the femur and the tibia together. And then you also have the lateral collateral ligament. And that's on the lateral side, again, connecting the femur to the tibia.